Welcome to today's lecture on sick sinus syndrome, SSS, a cardiac disorder affecting the SA node, the heart's natural pacemaker. We will cover mechanisms, diagnosis, treatment options, and prognosis associated with SSS. By the end, you'll gain a comprehensive understanding of this condition. Let's get started. The SA node initiates electrical impulses regulating the heart's contractions. Dysfunction can lead to bradycardia, tachycardia, or an alternating pattern. Causes include age-related degeneration, fibrosis, autonomic dysfunction, or genetics. Implications range from asymptomatic to fatigue, dizziness, syncope, and heart failure. Management depends on understanding the pathophysiology. Brady-Tichy syndrome, or tachycardia-bradycardia syndrome, poses challenges in managing pacing. It involves episodes of both slow and fast heart rhythms, often with atrial fibrillation. Dual-chamber pacemakers may benefit these patients, providing physiological pacing and reducing inappropriate shocks. Monitoring is crucial for optimal pacemaker settings. Diagnosing sick sinus syndrome can be challenging due to its various ECG patterns. Key findings include sinus bradycardia, sinus arrest, sinus exit block, and bradycardia-tachycardia episodes. Analysis of ECGs, clinical symptoms, and additional tests help confirm the diagnosis for appropriate management and intervention. Patients with sick sinus syndrome may not exhibit symptoms or may experience fatigue, dizziness, chest pain, irregular heartbeats, or fainting. Proper diagnosis requires a comprehensive evaluation, including medical history, physical examination, and interpretation of tests like ECG and Holter monitoring. Treatment aims to reduce symptoms and enhance the patient's well-being. Holter monitoring is an important tool to detect hidden heart rhythm abnormalities in sick sinus syndrome. It records continuous ECG for 24 to 48 hours, providing valuable insights into the frequency, duration, and patterns of arrhythmias. This helps guide treatment decisions, including pacemaker implantation or medication adjustments. While the primary pathology in sick sinus syndrome lies in the SA node, echocardiography plays a crucial role in assessing associated cardiac structural abnormalities. It allows for the evaluation of ventricular function, valve regurgitation, and the presence of structural heart disease that may contribute to symptoms or affect treatment decisions. Echocardiography can aid in determining the appropriate timing of interventions, such as pacemaker implantation or cardiac resynchronization therapy, CRT. The integration of echocardiographic findings with clinical and electrophysiological data provides a comprehensive understanding of SSS's impact on the entire cardiovascular system. Pacemaker therapy is the cornerstone of management for symptomatic sick sinus syndrome with bradycardia or Brady-Tichy syndrome. The placement of a pacemaker ensures adequate pacing and prevents symptomatic bradycardia episodes. Indications for pacemaker implantation in SSS include documented symptomatic bradycardia, sinus pauses exceeding specified durations, bradycardia-tachycardia syndrome, and exertional symptoms attributed to chronotropic incompetence. Careful consideration is essential when selecting the appropriate type of pacemaker and programming parameters based on individual patient characteristics and comorbidities. Dual-chamber pacemakers are often the preferred choice in managing sick sinus syndrome cases to optimize physiological pacing. These devices allow for atrioventricular synchrony and promote a more physiological pattern of ventricular activation. By sensing and pacing both atria and ventricles, dual-chamber pacemakers reduce the risk of atrial fibrillation and improve exercise tolerance. The programming of specific parameters, like atrial sensing, mode switching algorithms, and rate response functions, further enhances patient outcomes. Understanding the capabilities and limitations of dual-chamber pacemakers is crucial for effective management of SSS patients. Sick sinus syndrome can coexist with heart failure, and in such cases, the utilization of cardiac resynchronization therapy, CRT, becomes a treatment consideration. CRT involves the placement of a specialized pacemaker that coordinates the electrical activation of both ventricles, improving ventricular synchrony and cardiac function. When selecting candidates for CRT and SSS, proper patient selection criteria, including measures of left ventricular mechanical dyssynchrony, are essential. CRT can improve symptoms, exercise capacity, and reduce hospitalizations in carefully selected SSS patients with heart failure. The use of antiarrhythmic medications in sick sinus syndrome requires careful consideration of balancing rhythm control and potential bradycardic side effects. Antiarrhythmic agents, such as beta blockers and calcium channel blockers, may be employed to suppress atrial and ventricular arrhythmias associated with SSS. However, caution must be exercised with these agents, as they can exacerbate bradycardia and potentially worsen symptoms. Regular monitoring of heart rate, symptoms, and periodic assessment of medication effectiveness is crucial to achieving an optimal balance between controlling arrhythmias and avoiding excessive bradycardia. 6. Sinus syndrome frequently coexists with atrial fibrillation, AF, posing an additional challenge in management. The presence of SSS complicates the management of AF, as the necessity for effective rate control conflicts with maintaining adequate sinus node function. Individualized treatment strategies involving a combination of anticoagulation therapy, antiarrhythmic medications, and often, pacemaker therapy are required to balance the risks of thromboembolism, arrhythmia control, and bradycardia prevention. A multidisciplinary approach involving cardiologists, electrophysiologists, and stroke specialists is crucial for optimizing outcomes in patients with this challenging comorbidity. Long-term prognosis in 6 sinus syndrome depends on various factors, including the severity of symptoms, comorbidities, and adequacy of treatment. Timely intervention with pacemaker therapy and appropriate management of associated comorbidities, such as hypertension or heart failure, improves outcomes. Complications associated with SSS may include the need for revision surgeries, generator changes, lead dislodgement, lead fracture, infection, or inappropriate device responses. Understanding these potential complications ensures appropriate monitoring and intervention to minimize adverse events and maximize patient safety. In conclusion, 6 sinus syndrome is a clinically significant disorder that requires a comprehensive and multidisciplinary approach for optimal management. Timely intervention, appropriate treatment, and ongoing follow-up are essential for improving patient outcomes. Thank you for your attention.